Hello, folks. Mayor Tom Koch here, joined by Ruth Jones, the Commissioner of Public Health today. I'm going to talk to Ruth in just a minute about getting a little of an update. As you know, we've been trying to do these daily updates during the week as far as the COVID-19 relating to Quincy and Quincy matters. Today, I know some folks have seen or heard that the National Guard is in Quincy. They're actually at Marina Bay doing testing in conjunction with the plans with the state for a nursing home out at that location. So don't panic, folks. So we're getting some calls on that. It's all for the right reasons. So Ruth, I know you've been working your tail off along with your staff. You're dealing with a lot of issues, and first let me thank you for your leadership. You've been unbelievable.
Thank you.
And I've heard nothing but positive from our chiefs, from Brewster, everyone dealing with you. You've been top shelf. So I hope you continue to be patient, because I know the next 10 days are not going to be any easier.
Yeah, we're finding it a little bit more difficult as we're going along.
Can you give us a little update first with the stats?
Sure. So today, total number of cases is 237. Of that 237, 67 have recovered, so that's always a positive thing. 10 deaths, so we've had no one expire today, thank goodness.
And all those deaths, as I understand it, are all older that had compromised systems.
Most except for one. We had one that was a 57-year-old, but the other ones were all in their 70s and 80s with underlying health conditions.
Okay.
So.
Did the 57-year-old have underlying
Not that
health
I'm
issues?
aware of,
Okay.
no.
I'm 57. I'm a little nervous now.
Yeah, no, not that I'm aware of,
Yeah.
but that we're definitely seeing a spike in the cases. I think the surge is something that we're starting to see now.
Which has been talked about for several
Right,
weeks.
and we expected it.
Yeah.
They're doing a lot more testing at sites. There's, as you know, 2 sites in Quincy, drive-through sites, and we're seeing a lot of testing going on. So we expect the cases to continue to escalate, and hopefully at some point we'll see those positive cases go down.
Yeah, and I guess that's been the discussion nationally and statewide. Is I know different regions are having different periods where the spike is expected and trying to flatten that out.
Right.
And I know the governor talked about between the 10th and the 20th of this month. I don't know if that's still accurate. Is that?
I think that's what we're probably going to see. I think it's just a guesstimate with
Right,
everybody.
of course.
You can't really pin it down to 1 week, but I know that we definitely from last week have seen a spike in the amount of cases. So whether this is just the beginning of the surge or whether we're right in the middle of the surge now,
Right.
Remains to be seen.
Sure.
We monitor it every day, so we'll know.
And again, we offer our deepest sympathy to the families who've been affected by this. I knew a number of the people who have succumbed to this, and it's so difficult for them because they couldn't visit the family in the hospital. You can't have a public wake, you can't have a public funeral. So
It's
tough
so
stuff
hard.
for people.
You can't even grieve
Yeah.
in this type of climate, and so that makes it much more difficult for people. And we try to, talk them through it and explain. And I think a lot of people understand, but it's a tough time.
Any changes in the guidelines that have been set out? Social distancing, the mask issue, the gloves. What?
All of that remains the same, and probably remains the most important way people can avoid contracting this virus is that social distancing. 6 feet away from people at all times. Stay at home when you can. This is not the week. This week and next week are not the weeks to be going out doing your food shopping. Hopefully you've already done it and gotten your groceries, but if you haven't, take advantage of those early hours.
They must have enough toilet paper at home by now.
I know we do. We have plenty, so I'll be happy to share with people if we need to. But you have to be careful. Now is the time that we're seeing most of the cases, and so now is probably the most treacherous time to go out to public places. So social distancing, I know it's been recommended through the CDC to wear a mask. Honestly, we're getting a lot of calls on that. We don't have masks. Masks have been kind of at a shortage. They should be really safe for healthcare providers. But I know that the CDC is recommending masks for people. You can make cloth masks. You can put a scarf over your face. I just want people to realize that when you're wearing a mask, it's really not protecting you. It's protecting the other person. So in order to get full protection, everybody would have to be wearing a mask. But if you feel more comfortable doing that, you can just put a scarf around your face.
You wash your hands, right?
Wash your hands, wash your hands, wash your hands. Most important thing.
Okay.
Yeah.
Well, thank you, Ruth, for the update.
Thank you.
Appreciate all your hard work. On another note, because it normally would be coming up, we have canceled the Clean and Greener outing this year. Each year it's the first Saturday of May, and we're also going to postpone the Senior Olympics, which is also the first part of May. We're going to watch closely the dates set forth by the President and the Governor. I know at this point it's like that May 4th date, which could change again.
Could change,
It's all flexible. So I just want to get the word out on those items. We'll stay in touch. In the meantime, please follow the guidelines and stay well. God bless.